Today we are going to talk about why vegetarian food and the vegetarian food options matter in the hospitals, particularly the NHS hospitals. I'm Rajeev Gupta. I'm the co-founder and the co-convener of the National Hindu Health Network, and we are very keen on this project of Sattvic vegetarian food available in the hospital. And we have got a proportion of people working with us, and we would be delighted if there are more people who join the plea, so that people who have stayed hungry because they didn't eat the vegetarian food that was given, which was in form of pasta or the sandwich, and worse, even halal food was given which had salmon and fish in name of the vegetarian, and this is not something acceptable. I am, however, going to talk about what is the value and why food is essential and the vegetarian food logic scientifically in today's talk. Now, if we think we all are born and we gradually have been given the milk and then the weaning food and then the other food, and the variety of food increases as the time goes. And there is also international foods available now practically easily in most countries. But let's think of food. Why do we eat food? One is for taste of the mouth, and therefore that is good. But more important is the nutritional value. And food is essential part of recovery during the illness, particularly when you are admitted to the hospital. And beyond its nutritional value, the food also carries the cultural, religious, and emotional significance. For many Hindu patients, vegetarianism is not simply a dietary preference, but it's an important ethical and spiritual principle rooted in the concept of ahimsa or non-violence toward a living being. A large proportion of Hindu population follows a vegetarian diet. And many patients therefore expect that the hospitals will respect their dietary preferences and dietary practices during the treatment or hospitalization and recovery. When hospitals provide appropriate vegetarian options, it sends a powerful message of respect and inclusion. Ensuring the availability of a vegetarian food in the NHS hospital is both practical and beneficial. Vegetarian diets can support recovery by providing nutritious foods rich in vegetables, legumes, grains, plant-based proteins, and other things which are quite nutritious and will help the recovery. These foods contribute essential vitamins, minerals, fiber that support the immune function and overall health. And you know that fiber is very good for the intestine. It also has the value that actually regulate not only this our health, but also it's good to reduce the nutrient part, particularly the fat, and it's very helpful in weight management. I do weight management clinic, and therefore I'm saying that specifically to you. Now we go to the next step. The clear labeling of the vegetarian meals is very important, because many times a non-vegetarian food is supplied to patient who is vegetarian, and Sattvic food, particularly with a green label, is extremely important, so that people who are supplying food know exactly what to give to whom, and the patients can identify before eating. Patients should be able to easily identify whether meals contain meat, fish, eggs, and other ingredients that may not align with their dietary choices. And the transparent food labeling helps the patients feel confident about the meals that they receive during their hospital stay. In addition to supporting the patients, improved vegetarian options benefit the hospital staff and visitors as well, who may also follow the vegetarian diet. As plant-based diets continue to grow in popularity across the UK, expanding vegetarian choices within the hospital and catering services can benefit a much wider population than just the patients. The Hindu National Health Network has been actively encouraging NHS hospitals to review their catering policies and catering options to ensure that vegetarian meals are consistently available and clearly labeled. This initiative aims to promote both the cultural and healthy dietary practices, providing culturally appropriate food is necessary and is not simple but actually a powerful way to improve the patient experience. And when patients feel that their beliefs and values are respected, their trust in the healthcare provider grows and creating a more positive and supportive healthcare environment that will be congenial to all. Thanks for listening.